establish rapport, okay, gain the trust of the client, and set boundaries. Okay, this is also the time that the nurse should establish a contract. So basically, your contract talks about the expectation and the time frame of the relationship, or basically the meeting of the relationship. So contract can be, let's say, for example, Amanda. Okay, so Amanda, you are the nurse and I am the client. So Amanda would approach and tell me, okay, hi, good morning. I am Amanda. I'll be your nurse. I am the nurse assigned to you. I'll be meeting you every Monday, Wednesday, and Friday at 8 in the morning till 10 in the morning. Okay, so that is your time frame of the relationship, and we will be meeting, okay, from in the month or in the days of the month. Okay, let's say you will be meeting every first, second, third, all right, or every Wednesday of the month, every Monday of the month. So that is the time frame of your relationship. Okay, having said that, you are already telling the client that you will be meeting with her on those said date or on the time frame. Okay, and also you already mentioned about the separation or the termination of the relationship. Basically, you are setting the expectation of your meeting with the client. All right, that is in the orientation phase. Orientation phase, this is the first, or in your exam rather, this is termed as the first few days of the client's, okay, admission. Okay, so how do we establish rapport, gain the trust of the client? All right, so this is the time that we establish the contract. So what is your contract? Contract talks about the time frame of your relationship, your expectation about the relationship. All right, Amanda, I'll be meeting with you from Monday to Friday at 8 in the morning till 10 p.m. Okay, so starting January 14 to January 30, I am the nurse that is assigned to you. All right, so having said that, you already set the expectation, and you briefly talk about the termination of the relationship. You do not go beyond. Okay, you do not go beyond until January 30th or January, or you'd go beyond February 1st, okay, because that's already the time frame that you think as a nurse, okay, is enough to show any progress with the client, okay, while admitted in the facility. All right, orientation phase. Now, next phase would be the working phase. Okay, so working phase, this is actually the longest phase among the nurse-client relationship. Why the longest? Because this is the time that we identify the problem and find a resolution to the problem. Okay, so this is the time that the nurse would try to explore, all right, focus and evaluate the client's problem. What else? The nurse should also embody an attitude of acceptance and active listening, and encourage independence. Okay, so this is the time that the client would encourage independence or help the client develop problem solving and what? Coping mechanism. Okay, that is your working phase. So this is the time that we try to do activities for the client. All right, so okay, sorry, Chidera can't hear me. How about the others? Can you hear me?
Yes.
Yes.
Okay, so it's only Chidera. So I think Chidera have a problem with her audio. But anyhow, okay, so that is the working phase. Again, working phase, this is the longest phase in the nurse-client relationship. Why? Because this is a time that we identify, after your orientation, after your introductory phase. So this is the time that when you said to the client that I'll be meeting you tomorrow from 8 in the morning till 10 p.m., Monday to Friday or Monday to Saturday. So the following day, you get back or go back to the client, you now introduce yourself again, and then this is the time that you would start, with the working phase. So you will start to identify what are the problems with the client, what are the things that causes the client to be depressed, or what causes the client to have anxiety, so those the problems that the nurse should identify. By completing the working phase, and especially if you have already encouraged independence, you have already promoted independence, the client is now able to regain back to her the usual phase, before she was admitted or he is admitted in the facility. Then the working phase becomes effective, because after you have evaluate the client's response or responses to the stay, so this is the time that we are ready to terminate the relationship. We are ready to let the client be out of the facility. So in your termination phase, this is the time that we prepare the client for termination and separation on the initial contract. This is also the time that we evaluate, the progress and the achievement of the goals that we have set during the working phase. Now, this is also the time that the nurse must identify responses related to the termination and the separation. More importantly, the separation. Because what is a common problem here is that, especially if you have already established the rapport of the client, you have gained the trust of the client. Now, all of a sudden, there is somewhat what we call your separation anxiety. So what are those responses? During that phase that, you're already about to terminate the relationship. I have been with this client, I have been with this nurse for 3 weeks. I like her so much. I enjoy her company. And all of a sudden, 3 weeks after, then I will no longer see this nurse. Kind of sad, right? But to prevent that separation anxiety, you must also identify nurses. Either the client is already showing some like new attitude towards you, or the client is somehow grimace or sad, those common clues that perhaps the client is already or anticipating your separation anxiety. All right. Now, if it shows any clues about separation anxiety, then you have to, again, as a nurse, encourage verbalization of feelings. All right. And ask them what are their thoughts about, this next week, Friday, it's going to be our last meeting. I'd like to hear your thoughts about it. Would you be able to go back to your usual activity or go back to your usual pattern without me anymore? Because you'll no longer see me. But overall, I'm so happy with your progress. I'm so, proud of you with all the things that you have accomplished, and so on and so forth. All right. So that is your termination phase. Now, this is also the time that we refer the client to community resources and other support system. And make sure, nurses, that when you terminate the relationship, when you terminate the relationship, you have to be very clear. All right. And it is done gradually. So given on the example earlier that I had, so last week or next Friday would be our last meeting. All right. So on the second week of your relationship with the client, you've already briefly mentioned about, your last meeting with the client. So it's done gradually. Unlike, saying to the client that, oh, tomorrow is our last meeting. And then all of a sudden, the client would be, shocked, and you would not be able to identify those clues about, possible separation anxiety. Because again, our goal here during the orientation or in the introductory is to gain their trust, establish rapport. And then all of a sudden, you're breaking up with your client. So it's the same feeling when your boyfriend or your husband all of a sudden, breaks up with you for no reason at all. So separation anxiety. So when termination or when we terminate or end the relationship, we have to be very clear. So in your exam, it can be presented as what? It can be presented as, thank you so much. You've done a great job. Okay, you've done a great job. Goodbye and good luck. You do not say in your termination relationship, you do not say, thank you so much. I hope to see you again. Okay, because that only means that you're hoping the client to be back in the facility. It's not. Okay, we do not want that. As much as possible, again, the relationship, okay, that we establish with the client is in the facility is effective. The treatment is effective. Okay, because if you would say, I hope to see you again next time, that means that the client is not able to resolve the problem. Okay, are we clear? Clear, everyone? I hope I do not talk so fast.
Yes.
Okay. Okay. So again, those are the 4 phases of our nurse-client relationship. Now, in your working phase, this is the longest phase. This is the time that we do, this is the time that we identify and focus on the client's problem, find resolution to their problems. In your pre-orientation phase, there is no meeting yet with the client. However, there is already a client that has been assigned to you. So our goal here, our focus here, nurses, is in our own feelings, in our emotions, in our preconceived ideas, if I'm able to take care of this client or not. Now, in your orientation phase, that is a time that we meet with the client. That is a time that we have to establish rapport, all right, gain their trust. How do we do so? By establishing a contract. So a contract is your meetings or the time frame of your relationship. And during in the orientation phase, that is also the time that we slowly, or we mention about the termination phase. All right. And last but not the least, your termination phase. This is the time that, okay, we prepare the client for termination and separation. And when you do so, it should be done gradually. Okay. Are we clear? Okay. Clear, nurses? Okay, perfect. So on to our therapeutic communication. So again, in order for the nurse-client relationship to be effective, aside from the establishment of the contract during the orientation phase, a key role here that plays an effective nurse-client relationship would be the therapeutic communication, most especially during the working phase or the entire stay of the client in the facility. So as a nurse, you have to be very therapeutic. Okay, so I know a lot of you get confused about your therapeutic communication, but let's try to identify those techniques, okay, that would help us identify, oh, this is therapeutic and this one is non-therapeutic. Okay, so I have a list here, therapeutic communication techniques. All right, so the letter A, basically, this is asking for clarification. So asking for clarification because you wanted to be sure that what the client have said, okay, you totally, or you have a full understanding. So let me repeat back to you what I think I heard you say. Okay, I didn't understand what you meant then. Can you say that in different word, especially if the client is having neologism? Neologism, this is actually a coining of new words that is only the client, especially with schizophrenia, okay, client who are schizophrenic, they have this neologism. They mention words that is new and only them, okay, only these clients know the meaning of the word that they said. So as a nurse, you don't understand what the word they said, so you ask for clarification. All right, I didn't understand what you meant then. Can you say that in a different word? Okay, do you mean this and that? That is your asking for clarification. All right. Asking for clarification, again, this is therapeutic, most especially if the client is also suicidal. You have to be very direct for these clients. Okay, do you have any plans of committing suicide? Okay, asking directly and asking clarification to the client. Okay, therapeutic communication. Broad opening is also another technique when it comes to your therapeutic communication. So what is your broad opening? Okay, tell me what's been on your mind. All right, I'm interested in hearing about issues that concerns you. Okay, or talk more about it. So basically, you are encouraging the client to verbalize, okay, more, or to talk more about her own ideas, her thoughts, okay, for these clients. Broad opening. Tell me more. Okay, Amanda, can you tell me more about what are you thinking about this and that? Okay, therapeutic communication. A, asking for clarification. B, broad opening. Okay, letter C, we have here your collaboration. Okay, your collaboration. So what is your collaboration? Just 1 second. Okay, so collaboration, this is the nurse makes an offer to work together with the client. Okay, most especially in the working phase of your nurse-client relationship. So let's try to figure this out together. Okay, that shows with that response, you are only implying to the client that I am here with you. I am here to guide you. I'm not going to leave you. All right, let's try to figure this out together. Next, let's talk and see if we can work together and understand this. Okay, perhaps we can discuss this and see what offended you. That is your collaboration. Again, collaboration, or you collaborate. Okay, the nurse makes an offer to work together, okay, with the client. Letter D, we also have here your do offer oneself. Okay, so basically this is implying to the nurse. Okay, the nurse offers to stay with the client and either to talk or to just sit quietly. Okay, so do offer oneself. We have, let me sit with you for 15 minutes and read you a story. Okay, I'd like to eat lunch with you. Or we offer oneself, especially for clients with autism. Okay, because these clients, although they do not verbalize, they cannot establish, interpersonal relationship with their parents or with their nurses. And just to show your, empathy with these clients, or just to make them feel that you're around with these clients, especially autistic clients. So you just have to sit with them. What else? Those who are also rape victims. Okay, for those who are rape victims, so just to make sure that they feel safe, so you have to offer your presence. Okay, offer your presence, or do offer your one's self. You do not, especially for your rape victim clients, for your autistic client, you do not demand, okay, interpersonal relationship. Okay, for the reason, for clients who are autistic, they cannot establish, they have problems developing with, they have problems communicating. You do not make a demand on these clients that when you sit beside them or when you go near with these clients, you have to do some activities that, can you identify which body part is this? You do not. Okay. What else? For your post or your rape victim clients, they have this, what they call trauma. So they are highly emotional, and yet you do not impose. Okay. You do not want to ask about what happened. You do not want to know the details of what happened, okay, as to why the client had been raped. Okay. So just offer yourself, offer your presence by being with them. Okay. Or if not, for those two scenarios that I've mentioned, let's say for a client who is manic or for a client who is depressed, so I'd like to eat lunch with you would be a good example. All right. So another, we have your exploring. Okay. So exploring. So you're exploring. Okay. The nurse asks the client to describe something in more detail or to discuss it more fully. So you said you like Jo best. Okay, can you tell me more about Jo? Okay, tell me more about it. Okay, so just like similarity, you're asking clarification, right? That is your exploring, therapeutic communication. F would be your, Okay, focusing. So focusing, the nurse selects one topic for exploration from among several possible topics presented by the client. Okay, especially for a client who is having flight of ideas. So these clients would tell you about this and that and that. Okay, but just to focus the subject, you have to choose among of those what client discuss or tell you. So example would be your, you've briefly mentioned 3 different suicide attempts. For now, I'd like to, for now, I'd like to focus on just what was going on with you at the time on the first attempt. Okay, that is another example of your focusing. Okay, focusing. And what else? Refocusing. These are an example of your therapeutic communication. Focusing also applies for those clients who are in crisis, especially in a crisis state. Let's say, for example, there is a Hurricane Katrina, that happened in the United States. There is the 7-Eleven bombing at that time. So if you can only imagine being in that scenario, people are in crisis. They're not all of a sudden then this boom happened, and they'll be out of they'll be in shock. So as a nurse, you have to let them refocus. Okay, we are in this situation. I want you to think clearly. All right, that is also an example of your focusing or your refocusing. Okay. Another example or a technique in your therapeutic communication, okay, we have your general leads. All right, so general leads. So the nurse provides brief interjection that let the client know that he or she is on the right track and should continue. Okay, so general leads, okay, could be presented in your exam. Please go on. And, that only shows that you're interested, okay, as to what the client is sharing to you. All right. And last but not the least, we have the here and now. Okay, here and now, the nurse focuses on the client's issue at hand. Okay, the nurse focuses on the client's issues at hand, or those who are in crisis state. Okay, you're focusing and you're refocusing. Focus on the current situation. Focus on your, let's say for a client who are a rape victim. Okay, for these clients, rape victim client, they tend to, lose everything. Like, I'm not good enough. I'm no longer capable enough. But your goal here, okay, to prevent any possibilities of, from being rape victim, then here comes like depression. And then, because once depression sets in, most of the time, okay, those clients who are diagnosed with depression, they are highly suicidal. So to prevent that, from simple like problem or a crisis that occurred to them, and to prevent any possibilities of suicidal attempt. So you have, as a role as a nurse, okay, you have to focus on the issues at hand or the current issues, or you would try, or you would want to let them explore that it's not yet the end of the world. You are a nurse. You can definitely, be this and that. You can be a role model to everyone who also suffered the same problem. Okay, or let's say for a BWS, battered wife syndrome, it's not only you that has been abused. There are a lot of people or wives that has been abused, this and that, and so on and so forth. Okay, therapeutic communication techniques. All right, so having identified those therapeutic communication, let's also identify those non-therapeutic communication. So non-therapeutic, number 1, false reassurance. So false reassurance, don't worry, you'll be better in few weeks. Don't worry, I had a surgery like that and it was a snap. Okay, here's the thing, nurses. Okay, do you have a control of everything? Yes or no? Do you have a control of everything, especially if the
No,
client who is
you
anxious
know,
for the surgery? And then here you are, Monica. Okay, you interact with the client that, oh, not to worry, everything will be all right. So again, false reassurance is non-therapeutic because you do not have a control of everything. All right, giving advice or advices. What you should do is this, if I were you, I would do this and do that. Remember, your goal in your nurse client relationship is for them to be able to develop problem solving skills or coping mechanism. If you would give them advice, okay, it seems that you're stopping them to make up or come up with their own solution to their problems. Okay, you're stopping them to, like, being able to develop a coping mechanism. Okay, that's why giving advice or advices is non-therapeutic, or it's a no-no. All right, rejecting. Okay, please don't ever talk about, okay, that, or I don't like it when you do that, or so rejecting is also non-therapeutic. Okay, belittling. So everybody feels that way. Okay, why should you feel that way? So in your belittling, we oftentimes disregard the client's feelings, emotions. Again, whenever they are sharing to you their problems, okay, it is real to them. It is true to them. So you have no right to belittle their feelings, okay, their emotion. Hence, our role here is to acknowledge their emotions, acknowledge their feelings. It seems that you are this and that. Okay, I noticed that you are highly anxious. I noticed that you are this and that. Okay, belittling is non-therapeutic. Okay, defending is also, okay, non-therapeutic. All right, defending. All of the nurses here are great. It's non-therapeutic. Okay, again, you do not belittle their feelings, especially if they would verbalize it. I don't like the nurse. Okay, I don't like her. I don't like him. All right, and here you are. You're trying to defend everyone. That, okay, we're all good. We're all this and that. All right, so non-therapeutic. Okay, what else? Asserting your personal opinion is non-therapeutic. Asserting your own personal opinion is non-therapeutic. Your own personal opinion. Let's say the weather is beautiful today, and here you are talking about a beautiful weather to a client who is depressed. Okay, again, these clients who are depressed, they cannot see the beauty in everything because they feel that, okay, their mind is secluded about what's hurting them or what's causing them to be depressed. All right, so let them identify, okay, what is the weather now, or let them assert their own personal opinion or matter, or even like a situation or a scenario. All right, asserting your own personal opinion is non-therapeutic. Challenging is also non-therapeutic. Okay, you challenge the client. Okay, but how can you have cancer when all of your tests are negative? Okay, especially for a client with conversion disorder. These clients with somatoform type of the disorder, these clients, they present themselves with problem, even though that laboratory tests would show they're perfectly fine. And then here you are, you would challenge these clients, and well, it seems that all your laboratories are normal. Then why would you say so that you have this and that? Okay, challenging is non-therapeutic. All right, asking the client, okay, why? All right, why do you say so? Why are you late? Okay, because asking them why, okay, it's also like you are challenging the client. You're making them feel in a defensive state, right? Now, in a normal scenario, or in a very common scenario, that when your teacher asks you, why are you late? All right, John, why are you late? Amanda, why are you late? Or Frankie, okay, Frankie, why are you late? Or let's say Arya ask, okay, the husband, okay, husband, why are you late? Okay, so what do you think is the impression of the husband? Being asked, why are you late? Why are you this? Why are you that? Okay, so it makes us feel to be on a defensive state, right? Instead of like sharing your own opinions, your feelings, your thoughts, you can no longer share it. You can no longer be open because you feel like you are being, harassed by the person who asked you why. All right. What else? Another non-therapeutic communication, we have judging. It's your mistake if only you have listened to the doctor. It's non-therapeutic. All right. And also changing the subject. All right. So in this example, client, I wish I were dead. Okay, I wish we're dead. And the nurse, do you have any visitors? That is an example of your changing the subject. All right. So changing the subject is also non-therapeutic for a client with somatoform disorder. Okay. Now, oftentimes these clients with somatoform disorder or your conversion disorder, they would love to talk about their illness. And for the reason that you know for a fact that there's no underlying condition. And, oftentimes we just change the subject, that what you're talking or these client is non-true, is not true at all. So you would just change the topic. Again, changing the subject is non-therapeutic for a client. Okay. For a client, hello, can you hear me? Can you all still see me?
Yes, ma'am.
Yeah.
Okay,
Yes,
sorry,
ma'am.
I had a sudden power interruption. Are we all back?
Yes, ma'am.
Okay. Okay, so I had a sudden power interruption. Anyhow, going back. So changing the subject, again, this is non-therapeutic for a client with conversion disorder or somatoform disorder. All right. It's basically it's non-therapeutic, right? Changing the subject is non-therapeutic rather. But again, it only becomes therapeutic for a client with conversion disorder and somatoform disorder. Again, okay, changing the subject technically is non-therapeutic. Okay, changing the subject technically is non-therapeutic, but it only becomes therapeutic for those clients with conversion disorder or somatoform disorder. Okay, it becomes therapeutic because again, for a reason that the client has admitted, okay, because the client has presenting this, I have a stomach problem, even though that the result, all the laboratory results shows that the client has no problem in the digestive system. And here's the time, okay, these clients, they are attention seekers, okay? So they would talk to you about this, oh, I'm having gas buildup in my stomach. I cannot, I'm not able to remove my bowel. I've been constipated for 3 days already. So that's the time that you as a nurse, okay, would change the topic or change the subject. Again, I stand corrected earlier when I said I just got lost because I really had the sudden power interruption. Again, technically, changing the subject is non-therapeutic. All right. It only becomes therapeutic only if you deal with a client with conversion disorder or ear somatoform disorder. All right, and hopefully we would be able to talk about those two disorders later on as we go along with the review. Okay, are we clear?
Yes, ma'am.
Okay, yes, all right. So any questions?
No, ma'am.
Okay, well, thank you so much, Jacob, for acknowledging. So let's have a drill, nurses. Okay, so tell me this if this is therapeutic or non-therapeutic. Okay, so using silence, is this therapeutic?
Yes.
Yes. Okay, restating or reflecting?
Yes.
Yes.
Yes, very good. Okay, focusing and refocusing?
Yes.
Yes. Okay, reassuring?
Yes.
Again, reassuring is non-therapeutic. Okay, false
Non-therapeutic.
reassurance. Okay,
False
changing the subject.
No.
No.
Non-therapeutic, but again, it becomes therapeutic if your client has a what? Conversion disorder or somatoform disorder. Okay, advising.
Non-therapeutic.
Non-therapeutic, challenging.
Non-therapeutic.
Non-therapeutic, exploring.
Therapeutic.
Therapeutic, giving approval or disapproving.
Non-therapeutic.
Non-therapeutic, making observations.
Therapeutic.
Therapeutic, very good. Okay, another, all right, another drills. Okay, tell me if this is therapeutic or non-therapeutic. All right, my name is
Therapeutic.
therapeutic. Very good. Okay, why are you mad?
Non-therapeutic.
Non-therapeutic. Okay, don't be silly.
Non-therapeutic.
Non-therapeutic. Okay, go on.
Therapeutic.
Therapeutic. Nice weather we're having.
Non-therapeutic.
Non-therapeutic. Okay, I agree. That's right.
Therapeutic.
Okay, I agree. That's right.
Non-therapeutic.
Non-therapeutic. Very good. Okay, describe how you feel about being here. Therapeutic. Okay. What would you like to do now?
Therapeutic.
Therapeutic. Okay. Everything will be all right.
Non-therapeutic.
Non-therapeutic. Okay. Relax. That is nothing to worry about.
Non-therapeutic.
Non-therapeutic. Good job. Okay. So let's try to answer this one. Practice questionnaire says, okay. A woman has been having auditory hallucination. When the nurse approaches her, she whispers, "Did you hear that terrible man? He is saying nasty things about you." Which would be the best response for the nurse to take initially? All right. Initially, a woman who is having auditory hallucination. When the nurse approaches her, she whispers, "Did you hear that terrible man? He is saying nasty things about you." Okay, is it number one, "I didn't hear a man's voice, but you look scared"? Number two, "Oh, really? What nasty things he is saying about me"? Number four, "Who is he? Do I know him"? Number four, "I didn't hear a man's voice, but you look scared. Can you tell me more about what you're feeling right now?" Number four. Good job. Okay. So option number three, again, this is not the good option, nurses, or this is not the correct answer, because you did not want to make them like, because when we say hallucination, these are, like they would hear, or auditory, they hear voices that only these clients can hear. All right, we have several examples of your hallucination. It can be visual, it can be tactile, all right, or it can be auditory, or we also have this command hallucination, which is way more serious. Okay, because in your command hallucination, they would hear voices commanding them to go ahead, okay, pull that trigger, go ahead, okay, commit suicide. All right, so in this scenario, okay, "Who is he? Do I know him?" It seems that you are acknowledging what the client is hearing, which is not true or does not exist at all. Same thing with option number two. "Oh, really? What nasty thing is he saying about me?" All right, so you do not acknowledge, okay, what they hear, all right, because these are not true. All right, are we clear? Good job. Okay, how about this one? Okay. A 70-year-old woman who is hospitalized with dementia of Alzheimer's type. When her daughter visits the client does not recognize her. The daughter begins to cry and she shares her concern with the nurse. Which statement by the nurse would demonstrate an empathic response? Okay, how about the others? Okay. Number
One.
Number one. Okay, it must be difficult for you to visit your mother when she is confused about who you are. All right. So number one is the correct answer. So let's try to take a look at number two. If you're just going to cry when you come to visit, maybe you should not visit your mother. It seems that you're very rude, right? So number three, it's not unusual for people in your mother's condition to forget who other people are. Is it not unusual? Is it not unusual? It is usual, right? Okay. Okay. Number four, if these visits would upset you, maybe you should telephone your mother instead of visiting her. Okay. So number four, you as a nurse, you are ignoring the client's feelings, right? So number one shows empathic response, and let's you totally understand, okay, the scenario. You have a good understanding. Now another question. The client says to the nurse, "I'm going to die and I wish my family would stop hoping for a cure. I get so angry when they carry on like this. After all, I am the one who is dying." The most therapeutic response but the nurse is, okay, is it number one, you're feeling angry that your family continues to hope for you to be cured? Number two, I think we should talk more about your anger with your family. Number three, well, it sounds like you're being pretty pessimistic. After all, years ago, people died of pneumonia. Number four, have you shared your feelings with your family?
Number two.
Okay. All right. Number two, majority answer number two. I think we should talk more about your anger with your family. Okay. Is it in this? Okay. Number two, are you not exerting your own personal opinion?
Yes.
Okay. So again, exerting your own personal opinion is non-therapeutic, right? I think we should talk more about your anger with your family. It's wrong. Number three, well, it sounds like you're being pretty pessimistic. After all, people died ago of pneumonia. Okay, so you're not acknowledging the feelings, right? So number four, okay, have you shared your feelings with your family? Okay. Or number one, you're feeling angry that your family continues to hope for you to be cured. Okay, so number
one.
Why number one?
Number four, clarifying.
Okay, why number one? Richa, why number one?
We are asking for clarification.
You're asking for?
We are
Clarification.
restating the
okay?
statement.
And not only that, you are acknowledging the feelings of the client, right? You are feeling angry. So meaning to say, you definitely, okay, you know the situation or the client is feeling, right? So number one is the best answer. Okay, number four is wrong because, okay, first things first, as a nurse, you have to acknowledge the feelings. Okay, acknowledge the client's feelings or emotion. And this is also, instead of addressing the client's emotion or feelings in this scenario, as if like you are passing the buck to the family. Okay, you're it seems that you really acknowledge, the reason as to why the client is angry about the family. Because here, have you shared your feelings with your family? You're not addressing the emotions or the feelings of the client. All right. Instead, I would rather acknowledge the feelings and look for clarification. Are we clear? Yes or no? Clear? Okay. Okay. So another tip for you nurses, okay, another tip for you, especially in communicating for clients with delusions, okay, or not just for delusional clients, but also for clients with hallucination. Okay, first things first, you have to present reality. All right, present reality. For clients with delusions, okay, because when you say delusions, these are fixed false beliefs, right? And let's say the client told you that, okay, there's a snake in your, there's a snake hanging on your neck. Okay, but when in fact, reality is what is hanging on the client's neck is just a stethoscope. Okay, so with that said, all right, so you have to present reality to the client. Okay, so how do you present reality? This is not a snake, this is a stethoscope. All right, you present reality and you acknowledge the client's feelings. Okay, but you seem so scared. Okay, so and then allow verbalization. Okay, steps in employing therapeutic communication for our clients who are delusional. So you have to present reality to these clients. All right, acknowledge the client's feelings. What else? And allow verbalization of feelings. All right, but overall, nurses, points to remember. Okay, points to remember. Best responses are those that encourages the clients express more fully. What else? Reflect or restate what client has said. Number 3, encourage expression of feelings. Number 4, this one here, okay, seek clarification. And number 5, use silence but express being there. All right, never, nurses, never belittle the client's feelings. Advise or show approval or disapproval. Ask for explanation or why. Okay, most especially why. If you see this in the option, that's wrong right away. Okay, being defensive and asking questions answerable by yes or no. All right, are we clear? Okay,
Yes.
are we clear?
Yes.
Okay, before we proceed with the conceptual frameworks, okay, so in your conceptual frameworks, we're going to briefly talk, okay, let's have a review about, the psychodynamic theory of Freud, the psychosocial theory of Erik Erikson, and the structure of personality. All right, according to Freud. All right, so according to Freud, our personality is actually structured into 3. All right, so what are those? Okay, 3 structures of our personality. Now, it's not just only me who has this structure, but every one of us, all of us. Okay, we have this id. Okay, what else? The ego and the super ego. Now, according to Freud, all right, according to Freud, id is actually this is the self-centered, all right? This is the pleasure, okay? This is something that in our personality that seeks pleasure all the time, all right? So this is the self-centered. This is the one that seeks pleasure to avoid pain. And this is the inborn unconscious instinct. Now, inborn unconscious instinct, it's because when we are brought into this world, okay, we are helpless, right? We do not in order for us to survive, we have to cry, okay, because by crying, our parents would feed us. By crying, our parents would change our diapers, which makes us a feeling of uneasy. Okay, so we are seeking pleasure out from our, when we cry, okay, that is actually id that is working, okay, especially during infancy period, all right? This is the self-centered. This is the pleasure principle, okay? So let's say id. Okay, so you know that you're on a diet, you know that this food is not good for you, but okay, it seems that you are so craving, you're craving for ice cream, which is not good to you. You know, we have that, you know, especially with when it comes to food, you know, we always seek gratification from food, right? From let's say another, let's say being in a company with this person, even though that you are reprimanded not to go out with this person, you know, but because it makes you feel good, you know, you go out with this person. Okay, that is actually your id, the pleasure center. Now your ego, on the other hand, this is the conscious self. Okay, this is the I that deals with reality or the balance. Okay, the balance. Okay, the balance. Now, your super ego, okay, this is actually the unconscious level. All right, so it controls, inhibits, and regulates impulses and instinct whose uncontrolled expression would endanger the emotional well-being of the individual. Okay, so in application to you know, in our everyday lives, okay, you students, let's say Libby, okay, Libby is so busy studying and preparing for her NCLEX, and all of a sudden, you know, the friend of Libby, whom she have not met for 4 years already, suddenly phoned her in, and then very excited to tell Libby that, oh, I'll be in Australia, or I'll be meeting you, let's have a dinner on the 4th of July. I'd love to see you, this and that. Okay, but okay, Libby's exam is on the okay on the 5th of July. So the id now, okay, the personality of id, okay, says go ahead, you know, meet the friend because you have not seen her. It's very good to catch up. Okay, but your super ego would tell you, okay, the conscious, the one that controls or inhibits or regulates impulses, okay, it is the one that tells you that, are you sure? Okay, July 4th she would be meeting with you, but you'll go out and have a drink, but July 5th is your exam. Okay, isn't it not good? You know, that is the one that is controlling you. That is the one that, okay, that you know, stops you or give a stop to your pleasure center in your personality. So ego would come in to make a balance. Remember, ego is the I that deals with reality, or the one that gives the balance. So in order to give balance to the scenario or the situation, now, yes, you are excited, Libby, to meet your friend, but okay, you would tell your friend that I'm so excited to meet you. It's just that I cannot do on the 4th of July, but let's do it instead after my exam. Okay, because I'll be taking my NCLEX exam on the 5th of July. So let's do it on, like, you know, let's have a dinner on the 5th of July. So that is your ego. It addresses your id, and at the same time, it addresses your super ego. All right. So these are the structures of our personality that should be working, okay, most especially your ego. All right. Remember, your ego is the one that gives you a balance. What if something happens to your ego? Okay. What if something happens to your ego? Now, this is the time that these clients would suffer from schizophrenia. They are out of touch with reality. Okay. They do not have that conscious self. All right. Now, what if, okay, there's a problem with my id. I always seek pleasure. I always seek gratification. Now, this can tend to your antisocial personality disorder. Now, your antisocial personality disorder, this is something that these clients has no remorse at all. They do not feel guilty. they are what we call your criminals, okay? Because for them, they always seek gratification. They rob the bank, okay? What else? They commit or attempt to commit this and that, you know, that is your id, okay? Or what happens if there is an imbalance, okay? Imbalance with your super ego. What do you think happens? All right, so if there is an imbalance of your super ego, remember your super ego, this is the one that controls, right? This is the one that controls. So if there's too much or like problem in your super ego, so tendencies are you would develop that personality disorder, which is your OCPD, obsessive compulsive personality disorder, or it can also lead to your OCD, your obsessive compulsive disorder. Okay, you are like in a situation that is so controlling about like certain scenarios. Okay, that is the structure of personality according to Freud. All right, nice to know information, nurses. Okay, now your psychodynamic theory according to Freud, okay, from birth to 1 year, okay, our pleasure center is our oral. Okay, the pleasure center is oral. We seek oral gratification. 1 to 3 years, okay, the bladder and the bowel training, hence the anal stage. 3 to 5 years, the genitals, okay, or if you're familiar with your oedipal or your Electra complex, we're in at this age, 3 to 5 years old. If you're if you can only imagine, if you can go back from the time when you are 3 to 5 years old, okay, back then I was so attached to my father. Okay, I envy or I get mad if my mother would come near to my father. Okay, or on the other hand, you're so attached to your mother. You'd be so mad if your father would go kiss your mother, you know, like hug your mother. So that is the phallic stage according to Freud. All right. 6 to 12 years old, this is the latency. Latency, this is where, okay, take note, sexual instincts are relatively quiet. All right. Why? Because at this age, 6 to 12 years old, we are highly industrious. Okay, we are so highly like, we wanted to have this all girls group, all boys club, you know, same sex peers. Okay, 6 to 12 years, your latency or your latency. Now, your 12 years and beyond, this is the genital. Okay, the genital. So same sexual maturity, sexual relationships, and sexual activity. All right. Now, what else? Your psychosocial theory by Erik Erikson. Birth to 1 year. All right. Birth to 1 year, trust versus mistrust. Okay. Just a review, nurses. I know you have had this in your pediatric nursing. 1 to 3 years old, we have your autonomy versus shame and doubt. 3 to 6 years, initiative versus guilt. 6 to 12 years old, industry versus your inferiority. Again, industry, 6 to 12 years old, according to Freud, at this age, okay, sexual instinct is relatively quiet. Why? It's because we are highly industrious. All right. What else? 12 to 20 years old, identity versus your confusion. 20 to 35 years old, intimacy versus isolation. This is the time that we develop commitment. This is the time that we, all right, the right age for marry, okay, or establishing a relationship, you know, or commitment. 35 to 65 years old, generativity versus stagnation. So this is the time that we coach those who are at our younger years, okay, and 65 years and above, integrity versus despair. Now, 65 years and above, integrity versus despair, very common in a nursing facility, nursing home, that these elderlies would develop this despair. Why? It's because Okay, back in the day, they would now have the more time to reflect. Okay, I wish I could have done this. I wish I could have done that. I wish I could be more productive. So despair or depression could develop, okay, for these elderly. Okay, because again, according to the development or psychosocial theory or an individual's development at this age, okay, integrity versus despair. All right. So if you have so many things that lack in your life back then, if you feel like you're not accomplishing well, so despair can occur. Now, integrity, if you were able to establish a good, let's say, moral value, you've been a good example to your children, this and that. So integrity happens. Okay. So just an overview for you nurses. Okay, so next we'll talk about the therapy of care. So therapy of care, basically these are like methods or care or models of care that would help these clients. Okay, so first we have your Melu therapy. Okay, your Melu therapy. Your Melu, basically Melu, these talks about what? Okay, Melu talks about, okay, Melu talks about your, or refers to environment, okay, your environmental modification. So in here, as a nurse, okay, we wanted to be sure that the environment that we put in our client is what? Safe. All right. So Melu refers to the safe physical and social environment in which an individual is receiving a treatment. So our priority here, nurses, is safety. Safety environment. All right. Safe environment. So our goal here is to have a therapeutic encounters. So therapeutic encounters by establishing a what type of environment? Safe environment. Now, who among of these clients that would benefit the most in your Melu therapy? Okay, safe environment. Let's say for clients, okay, who are suicidal, all right? In order for us to maintain a safe environment for these clients, highly suicidal client, so you have to what? You have to remove what? Okay, harmful objects. Okay, remove harmful objects that may cause danger, or like be like remove or do not have the client in a suicidal client, there's no bed linens, okay, because otherwise they can just use this to wrap around their neck. Okay, that's how aggressive they are, especially if they are highly suicidal. Okay, remove harmful objects. Okay, make sure that the bed there's nothing under the bed, there's no harmful objects. Okay, safe environment. Another, we have those post-rehab client. All right, so those addict, okay, or those clients with substance abuse, okay, in order to ensure total elimination of their substance abuse, or be it with their drinking habits, okay, or drug usage. All right, so most oftentimes a client would have a substance abuse or substance related problems. It's because the community that they are in, right, the peers, the neighbors, their friends, and they are actually a factor. So you have already put them in a rehab. They have completed the rehabilitation. And sometimes, when you place them back in to the same environment where they, have their friends. So tendencies are there can be a what? Relapse, right? Relapse can happen because, it's useless. Like you have completed a rehabilitation, you're supposed to be free of drug or like alcohol free or like no drugs at all, but all of a sudden you put them back into the same environment, then relapse can happen. So to totally ensure, the total elimination or to prevent any relapse, okay, for those post-addict client or post substance or alcoholic client, okay, Melu therapy may apply. All right, so safe environment for these clients. As much as possible, the type of environment would be a new environment for these clients. Okay, new friends, new colleagues, or as long as it's a safe environment. All right. What else? For child abuse, okay, cases of your child abuse. What else? Elderly abuse. In order for them to ensure a safe environment, okay, Melu therapy, you have to remove them from immediate danger. Now, in your child abuse, there is a perpetrator, right? There is somebody abusing them. So as much as possible, you have to remove them from that home or from that house who is abusing them. Either the abuser or, very common, the parents. All right. So safety or Melu therapy for those child abuse, or for your elderly abuse who are abusing them. Very common, they're children, right? So safety for these clients. All right. Are we clear? Okay. Are we clear, nurses? Okay. Another therapy for care, we have your psychotherapy. Okay, your psychotherapy, this is actually consists of the therapist, all right? And this is usually a one-on-one relationship with your therapist, okay? A treatment modality that uses a therapeutic relationship. So this modifies the client's feelings, attitudes, and behavior, and work within an agreed upon time frame to help the client meet the goal. All right. So I think I'm not even sure if it's in Australia, you're able to go to your therapist, talk to your therapist, that's easy to reach out, and that you would not have, it's a common norm in other countries, okay, such as like Australia. What else? In the United States of America, whenever we feel sad, whenever we feel depressed, we go directly to our therapist, right? But unlike here in the Philippines, it's kind of like a taboo. Why? Because back then, when you go to a therapist, they would often mistake you that, oh, you have a mental problem, this and that. So it's a little taboo, but only now, okay, because of that pandemic, we already have an easy access to your analyst or your psychoanalyst, because a lot of people were not prepared for what had happened, right? Because of the pandemic, where all of a sudden placed in the house, stay at home strictly, you're not allowed to go out. So that actually caused a major problem with our well-being, most especially affecting our mental health. So luckily, even now, one-on-one relationship with your therapist can be done through virtual, all right, in a computer, through whatever mode of meetings, as long as these clients, okay, would need somebody to talk to or listen to their problems. Okay, that is your psychotherapy. All right, so these therapists would also seek explanation as to why you're currently behaving this way. So probably they would try to seek or identify, problems during your childhood that may affect your current behavior. All right, that is your psychotherapy. Another, we have your behavior therapy. So behavior therapy, this is actually more of a treatment approach based on the principle of your operant conditioning, and refers to the manipulation of selected reinforcers to elicit and strengthen desired behavior. So every, from the word itself, okay, behavior therapy or your behavior modification. Back then when we are growing, to like somehow refrain us from doing like, not like, or having not a desirable attitude. So our parents would punish us, right? Punishment is also a method of your behavior therapy that our parents used back in the day. It actually decreases that negative behavior. Another would be rewards, right? Rewards, these reinforces a positive attitude in a child. Okay, so rewards such as when we get perfect score in our scorecards, or if we get good scores, what else, we get a star when we go home, right? Our parents are so happy, and in order to reinforce that positive behavior, they would give us rewards, right? So that is your behavior therapy. Now, another example would be your desensitization. So desensitization, this is actually a form of your behavior therapy wherein we are gradually exposed to our feared objects, okay, that is causing us to have anxiety. So desensitization is very applicable to your clients with phobia, okay? Because when we say phobia, these are irrational fear. For some reason, you're scared to be in a closed space. For some reason, your fear of eating. You have a fear of eating. You have a fear of this certain insect. You have a fear of being in an open space. So to gradually expose you to your feared object or your feared stimulus, okay, we have your desensitization. Okay, gradual exposure. So that is your desensitization. Another form of your behavior therapy, we have your aversion therapy. Aversion therapy, this is a form of your behavior therapy whereby negative reinforcement is used to change a behavior. All right, a negative reinforcement is used to change a negative behavior. Aversion therapy is very applicable for a client with aversion therapy is very applicable for clients with alcohol dependency problem. Okay, why? It's because in here, that feeling of having a alcohol withdrawal, so you would continuously encounter that, okay, if you would drink alcohol, so drinking alcohol, too much drinking of alcohol is not good, right? So, and later on, this can actually lead to your substance related disorder. You've been so dependent to alcohol, you cannot function every day without drinking alcohol. And, the reason why you wanted to drink alcohol is because you're also now trying to avoid your withdrawal effects of the alcohol. So aversion therapy is something that would, every time when you drink alcohol, okay, you would have this severe or serious type of your withdrawal side effects. So hopefully I'd be able to discuss more about your alcohol as well as with your aversion therapy, hopefully by Friday. All right. So that's your behavior therapy. Next, we have your cognitive therapy. So cognitive therapy, basically, these are what you're thinking, our thought pattern, that whatever you think, all right, let's say, for example, you're so negative about yourself, you're thinking about negatively, then definitely this could affect our feelings or emotions. And once we are so conceived with that negative feelings, okay, we already have that negative emotion, then this can actually show into our behavior. Okay, so behavior, what happens is that you're no longer, you do not find pleasure anymore. If like you go to a party, it's because you have this idea, you're thinking that, oh, if I'll go to a party, then probably my friends will just tease me, this and that. I do not, so whatever you think would have an effect in your emotion and definitely would show in your behavior. All right, so cognitive therapy, this is a form of therapy that is active directive, time-limited, and structure used to treat various disorders, including anxiety and your depressive disorder, most especially your depression. Okay, so if the client is already having depression, the type specifically of your cognitive therapy would be your CBT, your cognitive behavior therapy. Okay, because what you think when you're depressed definitely affects, okay, your behavior for depressed clients. All right. Now, this is actually based on the principle that how individuals feel and behave is determined by how they think. Okay, do you agree with me, nurses? Do you agree with me that, okay, whatever the individual feels, okay, and how we behave is determined on how we think. Okay, so there are times, okay, when we are so anxious about our exam. Okay, remember anxiety benefits with your cognitive therapy. So in your when you are about to take your exam, okay, you have this like a feeling of anxiety, you're so preoccupied with your exam, with your NCLEX examination, or with your studies, then especially when you're doing your exam questions, right? You're doing practice questions, and then you have already undergone a review, a lecture, a concept review, but still you are getting low scores. Okay, so definitely that would affect your feeling. Okay, so it seems that you're so preoccupied that, okay, it's everything is not enough, what I've studied is not enough, it's still missing, there's still lacking. So you feel sad, okay, if you're getting low scores, and then behavior would show that you're no longer interested. Okay, I'm not gonna pursue my dreams and blah blah blah, so on and so forth. Okay, but okay, just to like, you know, in relation to that, just to share with you what you're doing, what you have, like sitting down for a review, going home as early as possible to sit down for a review and listen to the professors, what they're sharing, is already enough. You know, you've done so well, what you have prepared for the review. And please do not be mad or do not be sad if you are getting low scores in your practice questions. More importantly, nurses, okay, that you are learning. Okay, you are learning, you are you know, you're getting ideas. I'd rather get wrong answers while I'm still doing my practice questions rather than I'll get wrong answers on the actual exam day. Okay, so how do you address your anxious feelings? By just having a control of your thoughts. Have a control of your ideas. All right, it's mainly about thinking about the positive outcomes. Okay, thinking positively would have effect in our emotions, our feelings, and definitely in our behavior. All right, so that is your cognitive therapy. And last, okay, therapy of care or models of care, we have your group development or group therapy. So group development or group therapy, very commonly known as your group therapy. Okay, so this is actually comprised of 5 to 10 members. Okay, 5 to 8 members rather. Okay, composed of a therapist. Okay, one therapist and how many members? Okay, 5 to 8 members. All right, one therapist and 5 to 8 members. Okay, these members, by the way, should share the same problems. Okay, so members should be consist of, let's say, best example of your group therapy with your Alcoholic Anonymous, all right, or your AA, okay, Alcoholic Anonymous. Now, in this Alcoholic Anonymous, in this group member, all of them has problems with drinking. All right, so you cannot add one person in the group with, let's say, problems with shopping or being impulsive, because definitely that person cannot relate to what others are sharing and what others are, you know, coping with their problems. All right, So composed of a therapist and ideally 5 to 8 members with the same or similar conditions. All right. And best example would be your Alcoholic Anonymous. Okay. This is for your AA. This is actually for the drinker. Okay. For the drinker. Now, for the wife, okay, of an alcoholic client would be your Al-Anon, all right, Al-Anon. And for the teen or the children of the alcoholic client, that would be your Al-Ateen, all right, Al-Ateen. Basically, because your alcohol dependence, this can actually affect the family. Okay, this can definitely affect the family. Why? It's because once you're a drinker, instead you're supporting your family, you would now use your money for your own personal drinking, just to satisfy your drinking problems. All right, so that is your group therapy. All right, are we clear? Any questions? Okay, so let's try to answer this practice question. All right, which nursing intervention involves providing, structuring, and maintaining a safe therapeutic environment in collaboration with clients, families, and other healthcare providers? All right, which nursing intervention involves providing, structuring, and maintaining a safe therapeutic environment in collaboration with clients, families, and other healthcare providers? Is it Milieu therapy? Number 2, coordination of care. Number 3, health teaching and health maintenance. Number 4, pharmacologic, biological, and integrative therapies. Did we talk about integrative biological type of like model of care? No, right? So obviously number 4 is wrong. So the key word here, nurses, is what? Therapeutic environment. All right. Environment mainly refers to your milieu therapy. Okay. Again, what type of an environment? Okay, that is safe environment. Okay. Are we clear?
Yes, ma'am.
Okay, so would you like to proceed or would you like to have a break?
Please, sir, I have a question. I have a question. I know the answer is Melu, which everyone knows. Why is coordination of care? Which type of intervention is?
Okay, so coordination
of care is the? Yeah, and the health education and health maintenance. Which type of intervention?
Okay, coordination of care, basically this involves implementation of the nursing care plan. Okay, coordination. You are now coordinating your plans or your actions, okay, towards the client. All right. So health teaching and health maintenance. So health teaching, this is more of like in your working phase, wherein you do like your actions by identifying the problem of the client and by finding resolutions to the problem of the client. Okay, health teaching and health maintenance. Okay, are we clear?
Yeah.
Okay, and health teaching, basically this would, I would say, best apply in your psychotherapy, okay, the one-on-one therapy. It's because your therapist is the one that would implement health teachings. Okay, basically it's being general, when you say health teaching and health maintenance, and not just in your psychotherapy but also in your group therapy. Okay, so you share your problems, your emotions and this and that. So after that session, you would have that health teaching, like an open forum, so yeah. All right. Let's proceed, or would you like to have a break? Okay, defense mechanism. Your defense mechanism, this is just very brief. We've already know what are the defense mechanism. It's just a recap or recall. I would cite which are commonly asked here among of those defense mechanism, because we have a lot of defense mechanism, but not all, I would say, would come out in your exam, but at least you'll have an idea, just a recall or a recap of what we have learned during college. All right. So probably we'll just continue this one and then we'll have a break after this. All right. Or would you like to have a break already? I'm very okay if you guys would eat, as long as you'll place your microphone on mute and not to hear everyone nibble, like you're eating something. So okay, so let's just continue this one and then we'll have a break after. Okay, so when we say defense mechanism, okay, so defense, by this, like, it's something, an innate or nature for us to be defensive, especially when you are already at place in a anxiety provoking scenario. Let's say an individual would become defensive if, let's say, for example, Libby, okay, had a long-term relationship, okay, for 10 years, and all of a sudden, they broke up, and Libby was still on the process of recovery. And while she's malling, she went to Kohl's, to shop, and she suddenly saw the boyfriend, the ex, and the ex is with another girlfriend or another girl. So this ex, approached Libby. So, oh, hi, Libby, how are you? Now, in that scenario, in that moment, it's very natural for Libby to become defensive. And then she would say, oh, I'm totally good. I'm totally fine. Right? So how are you? Okay, so those are common defenses. Okay, that is nature, or that is like innate to us, that we would defend ourselves just to be, or just to control that anxiety provoking scenarios. Right? What else? Defensive state wherein you would come home late, right? So you would try to defend why you're late, or you would defend why did you fail the exam. All right. So basically, defense mechanism is actually a coping mechanism, okay, used by individual in an effort to protect what? To protect our feelings of anxiety. This is something that would help us control, okay, any anxiety or anxious state. All right, so we use defense mechanism all the time, and they're actually commonly used. Okay, defense mechanism. So commonly used, we have at least 5. Okay, commonly used defense mechanism. So these commonly used, okay, not just only used by me, but everyone, majority, okay, because these is the one that is natural, okay, instincts that are, when we are in a threat or in an anxiety situation. So what are those? Let's try to identify those commonly used defense mechanism. Okay, so we have your compensation. Compensation, this is an individual that tries to make up or perceive, lack in one area by emphasizing the capabilities in another. So example would be a high school student does poorly in studies or in academics, but this high school individual is talented, artist, or let's say a college student who is not really poor, but somehow challenged with the studies. But this college student happens to be a very good basketball player. Okay, that is your compensation. All right, you compensate, okay, or you make up for what is lack in your area by emphasizing that you excel in other fields. All right. What else? Another example would be your identification. The individual internalizes a characteristics of an idealized okay, or idolize person. So that is your identification. So an adolescent dresses like a rock star and mimics the behavior of that rock star. So very common in your women, like women, we have this, like we idolize like celebrities, and oftentimes, we forget that we are already behaving like our idol celebrity. And okay, what else? Best example also is that my niece she actually has a favorite artist. I forgot her name, but this artist actually has a weird haircut. Other half is very short and other half is very long of this artist. Okay, I forgot the name of that artist. And here, my niece, okay, love her so much that she also mimic, okay, the hairstyle of that artist. Okay, so she also cut her hair short, and the other half is long. All right, that is your identification. Now, identification also has a very, very similar to your defense mechanism, which is your introjection. Okay, so I will discuss later on what is your introjection. Okay, but identification, the individual internalizes the characteristics. Okay, so introjection, it seems that you're putting that idea to that person, and that person would now try to internalize that idea, that attitude, hence later on would develop into your identification. All right. Rationalization, the individual makes acceptable excuse for behaviors, what else? Feelings, outcomes, attempts to explain behaviors by logical reasoning, but does not address underlying feelings. Okay, take note, does not address underlying feelings. Okay, rationalization. Example would be a student fails the examination and says the lectures were poorly organized and presented unclearly, when in fact, okay, that student did not, okay, study as well. Okay, so rationalization. So you keep on rationalizing everything. So whenever you are provoked, so you would just tend to rationalize and this and that and that. Okay, so by simply avoiding, okay, underlying feelings. Another commonly used defense mechanism, we have your sublimation. Okay, sublimation, the individual substitute a socially acceptable behavior for unacceptable instinct. Okay, let's say strong sexual urge are diverted into more creative arts, such as like painting and sculpture. Okay, so especially for your adolescent, okay, because in your adolescent stage, this is where we have this sexual exploration already. But for a fact that this is not good or this is not acceptable. So sublimation is something that you would try to divert, okay, into more productive one. Okay, so or more acceptable actions or productive actions rather than engaging in your premarital sex. Okay, so another would be your substitution. All right, substitution, the individual replaces an acceptable emotion or goal by another that is acceptable. So example would be a woman rushes into marriage following a breakup with her boyfriend. Okay, so you have a substitute right away. It's because you're used to having that in a long-term relationship, and all of a sudden you broke up, and since you don't want that to experience again, the breakup, so you rush yourself into marriage. Okay, that is your substitution. You find a replacement. Okay, individual replaces an unacceptable emotion, okay, or goal by another that is acceptable. All right, so that is your commonly used defense mechanism. Now we also have your compensatory type of defense mechanism. So this is adaptive when used in moderation. It's used to, okay, if used in excess, okay, this can actually cause emotional problems. So emotional, take note. If used, okay, if used to excess, if too much, okay, they can actually create emotional or greater emotional problem. So we have your conversion defense, okay, conversion as defense mechanism. So conversion, as defined, these are emotional conflict that is unconsciously changed into a physical symptoms that can be expressed openly and without anxiety. An emotional conflict, okay, is unconsciously, you're not aware that you are, physically like showing this already into a physical symptoms. Okay, example would be on the day of your exam, you're highly anxious. All of a sudden, you developed a what? Okay, develop a diarrhea on the day of your exam. Okay, that is your conversion. Now, if used in excess, okay, conversion can lead to what we call your conversion disorder. Okay, if used in excess, conversion, your defense mechanism, conversion, all right, this can lead to your conversion disorder. Okay, we will talk about later on about your conversion disorder. So another, we have your denial. So denial, this is emotional conflict. Okay, emotional conflict is blocked from the conscious mind, and the individual cannot recognize its existence. Okay, so simply you are denying that you are alcoholic. All right, you are denying the fact that you are somehow feeling depressed. All right, so example of your denial, a person who is functioning alcoholic. Okay, functioning alcoholic is something that you are able to go to the office, still be able to provide food for your family. That is your functional alcoholic. Now, in your denial, okay, so an example, they will often simply deny that they have a what? Like a drinking problem, pointing out how well they functions in their job and their relationship. Okay, and denial is actually one of the defense mechanism for your clients who are alcoholic. Okay, because they would always deny that they are not alcoholic. Okay, how can I become alcoholic when I blah, 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 so on and so forth. Okay, denial. All right. So again, if used in excess, this can actually create greater emotional problem, which can, again, for an alcoholic client, all right, they tend to become alcoholic. Another, we have your displacement. Okay, displacement, emotional related or emotions related to emotionally charged situation or objects are shifted to a safe, or you have a substitute. Okay, displacement, you displace to a safe, okay, object, or let's say person. Okay, your emotions. Example would be a supervisor berates a head nurse. Okay, and when she goes back to her unit, these, okay, nurse speaks harshly to her staff. All right. What else? It could be that you have been confronted with your nurse manager, and on your way home, okay, you somehow express that emotion being confronted by your nurse manager to your children. All right, that is your displacement. Dissociation, okay, dissociation. This is actually a separation of any group of mental or behavioral process from the rest of individual's consciousness or identity. All right, dissociation, separation of any group of mental or behavior process. Example would be, okay, a client grins and chuckles when telling about the automobile accident and its tragic consequences. So what you are feeling is not related to what is, okay, what is happening. So, which is like you're trying to, somehow manage your anxious feelings when you are in that automobile accident, and while you're telling the stories, you chuckle, you grin. That is your dissociation. Okay, you dissociate, you separate your behavior or your feelings or your emotion, okay, to a conscious or your more acceptable scenarios. All right, another would be your fantasy. All right, your fantasy, this is like, consciously distortion of unconscious wishes and needs to obtain gratification and satisfaction. Conscious distortion of unconscious wishes and needs to obtain gratification and satisfaction. So very common that elderlies, okay, we fantasize something about this and that, right? So that is your defense mechanism, fantasy. All right, so another would be, all right, your intellectualization, use of thinking ideas and intellect to avoid emotion. Okay, somehow similar to your rationalization, right? So whenever you are in let's say provoked situation, so you somehow you intellectualize, you have these ideas that to avoid that emotion, you have to like internalize that, okay, I am strong, I am not this and I'm not that, okay, I'm not weak. All right, and intellectualization is also the consequences of your defense mechanism, which is your introjection. Okay, so introjection, again, intellectualization, what else? Identification. All right, identification, intellectualization are also the consequences of your defense mechanism, which is your introjection. So your introjection, this is acceptance of another's opinion and values as one's own. So example would be, okay, example of your introjection, let's say, for example, you have been bullied at school. All right, so you have been bullied, you have been berated, and to prevent that from happening, from bullying, so you now internalize that, okay, boys, I should be strong, I should not be bullied, boys don't cry. You already internalize that in your mind, that idea, and then from time that you keep on intellectualizing that, my father told me that, okay, he was once bullied, so this is what he did in the past. Okay, so you're now trying to introject the behavior or what your father used in the past as your own, and then you intellectualize that. Okay, so whenever you are in a scenario together with your classmates who are already who bullied you, you now start to becoming like those bullied student, which is your identification. You now mimic their behavior. So here you are, would now bully the other classmates. Okay, that is your defense mechanism, introjection. So acceptance of another's opinion and values as one's your own. All right, so another, we have your projection. So projection, this is unconscious denial of unacceptable feelings and emotions in oneself while attributing them to others. So unconsciously, you blame or you blame others when in fact, okay, you're not like aware that you are already blaming the others unconsciously. So in this scenario here or example, a reviewee blames the review center for his or his failure in the board exam. Okay, or it can be that, okay, projection, unconsciously denial of accepting or denial of unacceptable feelings and emotions. So when you go home, your mother asks you, why are you late? Okay, so here you are unconsciously telling that, oh, I'm late because my boyfriend drove me this and that. So you put the blame into someone, okay, unconsciously, projection. All right, reaction formation. we have this is unconscious prevention of unacceptable thoughts or behaviors from being expressed by exaggerating opposite thoughts or behavior. So overall, your reaction formation, this is your opposite feelings. Okay, you're being like not true to others. So a woman who is very angry with her boss and would like to quit her job may instead be overly kind and generous towards her boss and express a desire to keep working there forever. Okay, your feelings is opposite. Okay, so reaction formation. Okay, we also have your regression. Regression, this is a return to an earlier stage of behavior when stress is overwhelming at the present stage of development. So regression. So when somebody broke up with you, okay, we tend to regress, right? So we tend to like regress in a sense that we lie in bed, okay, in a curl up position, like C position, and then crying, okay, similar to the position of your toddlers or your infants. Okay, that is your regression. So return to an earlier state. Okay, a 4-year-old begins to wet his pants following the birth of his baby brother. Okay, and very common for your especially when somebody, like, there's a family would welcome a new baby, right? So either the first child, they would act like, oh, they wanted to be carried as well. They wanted to sit in the carrier as well. So that is your regression. All right. So repression, this is actually involuntary exclusion from consciousness to those ideas, feelings, and situations and that are creating conflict and causing discomfort. So example, an accident of victim does not talk about, okay, or does not remember the details of an accident, okay? You involuntarily exclude your consciousness or your ideas, all right? You do not want to share about that, all right? So an accident victim does not remember the details of the accident. Another would be, all right, your suppression. Suppression, voluntary exclusion from consciousness, okay, of those ideas, feelings, and situations that are creating conflict and causing discomfort. So a woman, okay, says she is not ready to talk about the abuse as a child. Okay, repression, take note, repression, let's go back. Okay, repression, involuntary exclusion, okay? Involuntary exclusion from consciousness of those ideas, feelings, and situations that are causing discomfort. Okay, involuntary, meaning to say you're not aware that you are already excluding your ideas, okay, or situations or feelings that is creating conflict or causing you discomfort. Whereas your suppression, this is voluntarily exclusion from consciousness. You're aware that is something that is provoking you, or there is something conflict. So you may not want to talk about that, because whenever you talk about that scenario, it's causing you anxiety. All right. So defense mechanism, suppression. Your undoing, on the other hand, okay, this is undoing, okay, the act of communication that attempts to compensate or negate, okay, a previous one. Okay, so basically undoing, a mother who punishes, a mother who just punished her child gives him a cookie. So undoing is also the common defense mechanism for your clients who are a victim of your battered wife syndrome. So in your BWS or your battered wife syndrome, it actually undergoes 3 phases. So after the battery happened, so the perpetrator or the husband, okay, would tend to, give gifts to the wife, okay? They would tend to undo what they have done, or the battery that they had committed to the wife. Okay, they would tend to go to an expensive restaurant, okay, go in a tour, so give gifts or lavish gifts or luxury gifts, and that is your undoing. All right, undoing. So these are, okay, your defense mechanism. Commonly, you have to be familiar with B, your undoing, denial. Okay, what else? Your compensation. Okay, so, but definitely, all right, we will, or I will provide you something that, okay, you'd be able to read along. All right, so as promised, so let's have a quick break, and hopefully we'd be able to discuss